This is a physical assessment by Trinae Stay, Victoria Williams, and Sally Phillips.
Come in.
Hi, how are you today?
I'm good.
I'm Victoria. I'm going to be your nurse.
Okay.
I'm here to do a physical assessment.
Alright.
Could you just please state your name and date of birth for me?
Trinae Stay, 5986.
Okay. Do you know where you are, Mrs. Day?
In the hospital.
Okay, great. Are you in any pain today on a 0 to 10?
I'm about 4.
Okay. Can you tell me where your pain is located?
On my left side.
Okay. What type of pain is that?
Like
Aching? Throbbing?
like a sharp cheese.
Okay. Does this just start in the past few days?
Yeah.
Okay. I'm going to go wash my hands and I'll be right back, okay? We'll get started. Do you need to go to the bathroom before we begin?
No.
Okay.
The assessment actually begins the moment you walk into the room. Look around the room, assess for safety. Is there an IV? If so, where is the IV site? If there is an IV site, check for redness or swelling. Note any NG tubes, oxygen in use, or Foley catheter.
Okay, Ms. Day, we're just going to start with getting some vital signs, okay?
Okay.
So raise your bed. You can just have your arms up. We're also going to take your temperature. Thank you. 98.6.
While you're checking vitals, you can also note the patient's affect, skin tone, and general sense of being. Is the patient comfortable? Is the patient agitated? Is the speech age appropriate? Level of consciousness, this patient's fully aware. Level of consciousness times 4.
Blood pressure is 120/70, and your heart rate was 60, which is within normal limits. Also check your radial pulse for a minute and watch for respirations for a minute.
Check the pulse for 1 full minute. Count the respirations for 1 full minute.
Next one is one.
When assessing the patient's head, note if the hair is evenly distributed, looking for any bald spots or patches. Note for any bruises, bumps, or lacerations. Also note for any lice or any other abnormalities.
Okay, Mrs. Day, we're just going to do a quick brief eye exam. If you can cover one eye for me
Okay.
and just repeat the numbers on the chart.
Okay. J, K, L, M, Q, R.
Okay, and if you don't mind doing the same with the other eye, please.
J, K, L, M, Q, R.
Great. Do you wear any contacts or glasses?
I do. I wear contacts.
Okay, great.
Cranial nerve 2 is intact. Next, look at the patient's eyes. Is the sclera white? Are they evenly distributed on the face? Is there any eye droop?
Okay, Mrs. Day. Next, I'm just going to turn off the lights, and I'm going to shine this pen light in your eyes. If you can just focus straight in front of me for me, please.
The nurse is now checking what we call perla. Are the pupils of the eyes equal? Are they reactive to light? And do they accommodate? We'll next use the 6 cardinal fields of gaze.
And next, I just need you to follow my pen light for me without moving your head. Thank you.
We've now assessed cranial nerves 3, 4, and 6.
You have very nice eyebrows.
Thank you.
You're welcome. And next, I'm just going to take a look inside your ears. Do you wear hearing aids, Mrs. Day?
No.
Have you had any problems with your hearing lately?
No.
When checking the ears, note if the pinna is intact, if it's even, if there's any lacerations in or around the ears. To check cranial nerve 8, the vestibulocochlear nerve, you can do a whisper test.
Okay, Mrs. Day. I'm just going to come behind you, and if you can just repeat what I say, please.
Okay. Yellow.
And I'm going to do the same on the other ear.
Purple.
Great.
This patient's cranial nerve 8 is intact.
Do you have a history of sinus surgery or sinus issues, allergies?
No.
Okay. Just going to take a look inside.
When looking in the patient's nose, look for a deviated septum or any lacerations in the nose.
Okay. Next, I'm just going to give you something to smell, and if you could just tell me what it is, please.
Okay.
Are you ready?
Yes. Coffee.
Yes, ma'am.
Great.
Although this is often not done, this is a way to assess the olfactory nerve, which is cranial nerve number 1.
Next, I'm just going to place my hands on your side of your face, and if you could just bite down for me. Great. Now I'm going to place this on your face, and each time you feel it, can you please tell me?
Okay.
Great.
This assesses cranial nerve number 5.
Okay. Next, I'm going to take a look inside your mouth. You could just say ah for me. Bigger ah. Can you move your tongue side to side? Great. And if I could just take a look into the side of your mouth to check your mucous membrane.
Check for mucous membranes that are intact and moist and pink.
Could you shrug your shoulders, please? Could you turn against my head like this, please? Great. Next, Miss Day, can you just do some facial movements for me? Raise your eyelids. Puff out your mouth, cheeks. Go in. Can you repeat light, tight, dynamite?
Light, tight, dynamite.
Great. Thank you.
We've just assessed cranial nerves 7, 9, 11, and 12.
Next, I'm just going to check your carotid pulse. Inspect your carotid pulse bilaterally. Carotid pulse is regular.
Never check the carotid pulses at the same time. This could put the patient in danger.
Could you grip my hand, Mrs. Day? The other hand, please. Okay. Could you push force against me? Great. Next, I'm just going to take a listen to your lungs, okay?
Okay.
When auscultating the lungs, move from side to side and down.
Could you take a deep breath in for me each time I move my stethoscope, Mrs. Day?
Okay.
Note for any abnormal breath sounds such as rails, crackles, and wheezes.
Now if you would just mind leaning forward for me so I can listen to the back of.
When listening to the back or auscultating the back of the lungs, it's also a good time to look at the patient's skin and the bony prominences of the shoulders. Note for any skin breakdown or the beginnings of any pressure ulcers.
Okay, you may lean back now. If I could just see your arm, please. We're going to do a little bit of range of motion.
Okay.
Lift it up, lift your arm up for me, please. Thank you. Your other arm. Very good. Up. Can you touch your fingers? Great. Just want to assess your skin turgor.
Assessing skin turgor will show any dehydration in a patient. This is particularly important in older patients as they tend to dehydrate easily. When you pinch a small portion of skin over the clavicle, it should pop back.
Next, I'm just going to auscultate your heart sounds using 8-to-man method.
As we auscultate the heart sounds, as when we get to the apical, listen to the heartbeat for 1 full minute.
Great. Next, I just want to check for your radial pulse. Palpate for your radial pulse. Brachial.
Assess all the pulses on your patient. Are they equal? Are they bounding? Are they present?
Just inspect your upper arm. Make sure everything looks okay.
Again, this is also a good time to be inspecting your patient's skin, looking for any skin breakdown, lesions, bumps, or bruises.
And just inspect your fingernails, please, and check for capillary refill, which should also be less than 3 seconds. You have nice fingernails. Mrs. Day, when was your last bowel movement?
Yesterday?
Do you have any issues with straining or excessive stools?
No.
Okay, great. Next, I'm just going to take a listen and inspect your abdominal area.
Okay.
I'm going to have to lean your head back a little bit, though, if that's okay.
Okay.
Have you had any breast exams recently?
Yes.
Okay, and everything came back normal?
Yes.
Do you have a history of breast cancer in your family?
No.
This is a good opportunity to educate your patient about a breast exam. Is she examining her breast? Does she understand how to do it? For video purposes, we will not be doing a breast examination.
I'm just going to auscultate first.
When listening for abdominal sounds, note any slow movement, any overly quick movement being peristaltis. If you hear no movements in any of the quadrants, you have to listen to each quadrant again, 5 minutes each quadrant.
Okay, next I'm just going to palpate your abdominal area, and please let me know if you feel any tenderness. Any pain? Mrs. Day, do you have any problems with urination?
No.
And do you still have your monthly menstrual cycles?
Yes.
Okay. Just going to raise your head of your belly now. If you don't mind, I'm just going to move one of the covers over to the side.
Okay.
Can you bend at your knees for me and back out?
At this time, we would ask the patient to turn over on her side and inspect the back of her body. For video purposes, we will not be doing this, but this is a very important step in our physical assessment for a patient. Often when people are in the bed for a long time, they can develop pressure sores. We need to look for these.
You don't have any swelling. Calf refill on toes is also within normal limits. Could you bend your knee one more time for me, please? Just going to check your pulse up till bilaterally. Okay. Up until pulse bilaterally is regular. You bend your lip. Can you push against my hands, Mrs. Day? And pull towards you. Okay. Check your pulse. I believe this completes our physical exam. Is there anything else I can get for you?
No.
Okay, I'm just going to lower your bed back to the lowest position. You got your call bell right here.
Okay.
In case you need anything, I'm going to go document my findings, and I'll be back to check on you later.